nobody has ever heard about that nutrition is causing dental problems or gingiva problems.
Volker, how did you find Carnivore?
Well, thanks, Dave, for having me on. Well, actually, in my personal life, it started in 2013, um, where I found Carnivore here in Germany. Not Carnivore, but keto. And at that time, nobody was talking about ketogenic diets here in Germany. And because of I'm pretty vocal, I was very vocal about it because I was so um, what do you call it in in English? Enthusiastic about it because of the possibilities. I talked to everybody I know about, but nobody listened to me, and everyone said it was crazy. Can't work. I talked to doctors, and I know it's dangerous, so don't do it. And the only one who listened to me was my dad, who was an 80-year-old dentist at that time, retired. And so I talked to him because nobody else would listen to me. And that's why I talked to him. And after 2021, when I got into keto, I started to implement all these informations that I gathered for almost 10 years into my practice and my work. And I want to talk about later on this professional part. And just wanted to start with my personal experiences, where I started and where I came from. And so in 2012, um, 1 year before I got into keto, my mother died of lung cancer. And of the same, more or less, week, my dad got the diagnosis of kidney cancer. And it was his second diagnosis of cancer because he survived a brain cancer 20 years earlier. So he had to retire at that time. And well, that was the starting point for me because my grandparents, or my two grandfathers, also died of diabetes and cancer. And as a father of three, and as an age of 45, I thought, well, that's not a very good outlook if I don't change anything. So that was this part. And a couple of months later, um, I got to the, I went to the doctor because I was feeling not that well, but not that bad. But the diagnosis came out. I had pre-diabetes. I was overweight or obese, depends on thinking. Had high blood pressure, and because of the diabetes, ophthalmologist, eye doctor, found out that my I had arterial leakage in my retina. So the vessels began to get destroyed because of the sugar. I had also high hay fever with quite intense asthma. So I thought, well, that can't be the way. I can't stay on this for longer. And my doctors told me you have to take medications and all that. And I said, no way, it's not for me. Then I got into digging into all this stuff, nutrition and all that. And then I found keto. And one advantage that I have, I really can dig deep into things when I'm onto it. My wife would say I'm obsessed with something, and she has to leave me alone because I can take hours and hours on learning about things that are really interesting. So I usually get up at 4 o'clock in the morning to have 3 hours of free time for me to learn and to read all this biochemical stuff and all that. And I did that for roughly 8 years, every morning, 3 hours at least, and the weekends even more. So I collected some information about this health stuff and keto, and later on carnivore. When I got into carnivore and keto, I had to change a little bit more. So I went into free climbing. That's what I do 3 times a week for 12 years now. So I got really fit, really strong, and not like Sean Baker, but kind of. Um, yeah, that helped me quite a lot. I lost about 20 kilograms of body fat and gained 10 kilograms of muscle. So I'm 190 centimeters, and I was about 110 kilograms at the beginning. Now I'm a little bit under 100 kilograms, but pretty lean and fit. So it helps me a lot to get up the walls and the the rocks. And my father, who joined me, he was 5'7", about the same weight as I was. He lost 35 kilograms, and it didn't take him very long to get rid of his insulin, which he was on for over 30 years. And it took him 3 months to get off totally of his insulin and had half of his metformin. And then he had to reduce his blood pressure medications because everything was getting wrecked. And he felt so good. And all the doctors were really shocked that he got off these medications. And he said, well, if I stay on it, I feel horrible. So if I get off these medications, I feel much better. One part of it was that at that time, my dad began to get into Alzheimer's, and it starts to get progressed. When he changed it and changed into keto, took him about, I would guess, maybe 1 year or 2 years, and it was totally gone. He was 82 or 83 years old, and he was able to play with his kids, was able to talk to the kids at the table when they were running around and screaming and all that, and he enjoyed it extremely. And for at least 5 or 6 years, he took part of my job by taking the kids to parties and getting me at home at night. And he was really part of the family. And when he was 80 and all these problems occurred, he thought it was over. And keto gave him back almost 10 years of his life. And
That's
connection with his,
fantastic.
yeah, it was absolutely great. And he enjoyed it so much with his grandkids and had so much fun with them. Built a tree house during that time, which is remarkable because it's gigantic with a bridge, 2 houses, and fantastic. He did it all by himself. So fantastic. And after that, he died at 89. And although he was diagnosed with cancer, second time cancer, he was cancer free at 89 because after surgery at 80, it didn't come back. So no reoccurrence. And I thought I think it was because of the keto, because he was really, really strict about it, because it made sense to him, not to the doctors, but to him. And he was really on it and was very, strict, more strict than I am, or I was. About 8 years later, after 10,000 hours of reading and listening to all this stuff, I got rid of all my problems, got lean, got my eyes back in shape, no blood pressure problems, got my testosterone up again, no CAC scores, zero now. So everything's perfect. So it got a little bit boring because nobody was listening to me. I had nobody to talk to. So I said, okay, I have to bring it up a notch and start to go carnivore, because at that time I had to listen to Ken Berry and Sean Baker and all the other guys. I said, well, if they can do it, I have to try it. I started 2021 in this Corona session where it was a little bit difficult, but I had nothing to do except of working and staying at home. So I said, well, let's do something else. So I started with carnivore, pretty strict, not perfectly, but only some macadamia nuts and some dark chocolate, a little bit of coffee and a little bit of milk, but no plants. So, but then there was something funny that occurred, because at that time I did some Muay Thai training, so Thai boxing. I had a small injury. I kicked my trainer, and I got a bruise in my right big toe. And I thought, well, it's just small damage, nothing special. But it stayed there. It stayed there for 2 years, and I couldn't get rid of it. Although I tried everything, but it didn't disappear. And after 2 years, I got tired of this tooth, because sometimes during climbing, because sometimes you only stand on your one toe, and it really does disabilitated me a little bit. So I thought, well, let's go lion, because I heard about Michaela Peterson stuff and said, even if you have little problems, and sometimes they don't go away. Say, okay, come on, it's not that much of a deal. Let's go on and try to go lion. I did that, and after I think 3 weeks, I woke up one morning and my toe was not hurting anymore. And I said, that can't be. That's weird. Why should that work? And then I heard or read quite a lot about oxalates, and at that time also histamine and estrogen for my wife, and how that is connected, these functional medicine stuff. And I got dug a little bit deeper into oxalates, and I said, well, might be the oxalates, because macadamias are pretty high in oxalates. So I reintroduced them to find out if it does work or not. And 2 days later, the pain came back. And then I tried it with chocolate and with coffee, and it didn't come back. So it was not the coffee and the chocolate, which is good for me because I like chocolate. Um, but the macadamia nuts was one of my sins that I really ate every day, almost. Not very much, not very many, but every constant day. And then I quit them totally. And now I'm free, no problems anymore, and starts to heal. That was really funny because I thought it was totally healthy and I had no any problems. But then occurred this, and I found out that even a little tiny little bit of these lectins, oxalates, whatever toxins, plant toxins, can do make a huge difference to your health. Whether you find out that you have any problems, or even if they are not obviously or obvious, then you still can have these kind of problems inside. So that's why I turned more or less to strict carnivore. And what I found personally, because I'm really into climbing and all that, so I do it 3 times and train at home while I'm not climbing. Um, I found out that my endurance increases a little bit when I take in a little bit of carbohydrates, not that many, but like 100 grams of milk or something like that. And now I'm experimenting with that and trying to find the best ratio, because in summer I go into the Alps climbing with my climbing partners, and it helps if your endurance is as good as possible. So that's why I'm just tweaking a little bit on this part. But as I said, it works perfectly. I'm really healthy. I'm really elastic. I can almost do a split on the wall, so my legs go out like 90, 180 degrees. So I'm working hard on it, and it's getting better and better. But as long as I have my job, which takes some time, I can't go on and train more. Although it does not irritate my hands, because I usually do microsurgery stuff and all that, so I need really slow and precise fingers. But that works out really well. So that was this funny thing about my experience with my the oxalates. Um, my wife started keto 2016, something around this, because in the beginning she thought I was crazy doing this stuff. But after a while, I tried and talked to her and explained it, all that, and then she said, "Well, it sounds quite reasonable what you're talking about." And then she started to listen to Dr. Boss and all the other girls on the internet, and then she joined in. Then she started to try to prep the meals for the kids, all this fancy stuff without flour and all that. But after a while, she got bored about it. Said, "Why don't we just eat meat?" And at that time, plants, but not this bread stuff and all that. So she stopped cooking and just prepared the meal with an air fryer and some broccoli and cauliflowers and all that. So, and the kids also got into that more or less. But for her health didn't change that much. And in 2022, she said, "Well, okay, I join into carnivore." And it took her 3 to 4 months, and her migraines that she had for 40 years, which were really debilitating for two days in a row for every month, were gone, totally gone. She had no ibuprofen that she had to take anymore, because at that time, before that, she had to take ibuprofen like 5 a day, 600 milligrams to get rid of it or to make it reasonable. That's why she said, I have to change it because it destroys my liver. And although she's very lean, she had problems. And then we found out with the help of Rob Sivas, which we're patients now at his clinic. Although we're in Germany, we talked to him online. And we made it possible with the blood tests and all that. And he found out that she's pre-diabetic too, although she only weighs 55 kilograms at that time. She had a high, the HbA1c was like 6.7 or something like this. And nobody was talking about it. And nobody told her, although she had this for years. And everyone would say, well, you're lean, it can't be a problem. And the liver was not very good because the ibuprofen was far too high that she was taking. And that was one of the reasons we talked we talked to Rob Sivas, and then we get all into these specialties and we get rid of all the problems with her. Her numbers are absolutely perfect. Mine too. Then we got the CAC score where we found out we have no problem, no plaque, nothing at all. Although we're on a dangerous diet for almost 10 years, but there was really nothing on. And we were fit, no brain problems. I was fit for almost 8 years, something at that point. And so that was the point where I said, well, my wife is fit, my kids are getting better. The skins of my one boy was much better. My daughter is just trying to get into carnivore now, and is feeling much better. She's 20 years old now, and she's really, really happy that the mood get better and all the other problems that women have at that age. And she's really, really happy. And it's more easy to cope with her at the moment. A year ago, it was far more difficult. So if anybody knows about how to 18 to 20-year-old girl can be a blessing or not. But now she's a blessing. Absolutely. I love her. And during that time, I've thought about what's going on in my office because I have so many patients that I talk to, and I always see these sick patients. They come with dental problems, so they've got this huge list of medications. And if you talk to them, say, "Well, a doctor told me to take it," and I say, "Well, one doctor tells you to take the same medication in the morning, the other one tells you to take the same medication in the evening. Do they talk to each other? That doesn't make any sense." I've got patients who have got 10 medications in a row. And I heard one guy who's specialist, worldwide specialist, who was here in Germany. He talked about the complications in the combination of medications. And he said, there's nobody in the world who can tell you if you take 3 or more medications, how the combination works or the problems that occur. And there's so many people who have 5, 6, 7, 10 medications, and they're absolutely unhealthy. They're not well. It's really horrible. Then I try to teach them or to explain them what they can do personally. But as a dentist, I'm not allowed to. So I can only advise them to read a book or to watch videos to get into keto, because carnivore is a little bit difficult because everybody's afraid of only eating meat. Some do. Some are really happy if I tell them, "Yeah, you can do it. Just only eat fatty meat, and that's it." They, really? I don't have to eat this crappy flour stuff thing there. But very few are. But some are really happy. I'll say, my husband will love me if I say you can only eat meat. So I probably saved some marriages. That thing. No, but in this situation, I thought about that, what happened to me and what's happening in my practice and all this stuff that I'm working on. Because I do periodontology, implantology. That's my main business. So I try to get rid of all the inflammations, take out inflamed tooth, soft tissue that's inflamed, and try to explain them. But nobody, and I teach quite a lot about dentistry and microsurgery. Nobody has ever heard about that nutrition is causing dental problems or gingiva problems. When I heard Jordan Peterson, I don't know if you heard about him, and when he was talking about his dental problems. I said, well, that's interesting. Because I thought the same way, but I'd never had a patient who talked about changing to carnivore diet and resolve his problem with his gums. So I wanted to tell you something about my story in the dentist, as a dentist or in a practice, first of all, to inform some patients who usually go to a dentist, like taking your car to somebody who's repairing it. It's just like medical work, like manual work. So it's more
like a
like,
service or something.
yeah, it's more like blue collar working, because surgeons are just hard-working blue-collar workers with special knowledge about some things, but it's just not just manual work, what we usually do, or we prep a tooth, or we take out a tooth, or we replant an implant in there, but it's usually manual, and we do not care much about medications and the overall health of the patient, because that we have never heard anything about it in dental school. So when I started to get into this, I said, what's missing in my job? It's something really big thing I'm missing. And a couple of weeks ago, I had a meeting with some colleagues, which all train patients, and they would all train other dentists. And so the teachers get together and talk about this. And I was the one who said, well, had anyone thought about nutrition and all that? And then I tried to explain it a little bit. We got into histamine and all this stuff, and how these neurotransmitters work, and all this depletion of other things. And they were stunned because they'd never heard anything about it. I said, well, and you try to treat a patient who's inflamed, and you've got no idea why the inflammation is there in the first place. So when I started 30 years ago, it took me a little while, and then I got into postgraduate studies. One part, not my specialty now, but one part was TMJ therapy. So grinding and clinching with the teeth, and how you treat it. And simply put, you just put some plastic on the tooth, and you align it a little bit, and that's it. And you have to live with it. So that's the way it is. Nobody knows where it comes from, and still nobody knows it. So I thought, well, that's a little bit strange, because why is the brain just putting your information of crunching and climbing and clinching just into these kind of two muscles here, or 5 muscles, and not anywhere else in the body? And so I dug a little bit deeper, and I found Dr. Eric Berg, who talks about serotonin connections and dopamine connections and all that. But he's the only one, because he's not a dentist. We can talk about the stuff that might be also important in the metabolic problem. So I started 25 years ago with this postgraduate stuff, and where I learned quite a bit about the alignment of the teeth and the associations with your whole body. And when I was back in office, I talked to my physiotherapist, who's also into these TMG therapies, and she said, yeah, let's have a look at yourself. Because you said, I had a problem with my left knee since I was 16, 18 years old, because I played a lot of squash, and it was heavy at that time, 90 kilograms. So I had a lot of pressure on my legs, on my knees, and I had problems with my left knee. So I talked to her, and she looked at me and said, well, of course your left knee is hurting, because you're totally wrecked. Your hip is not aligned. Your one leg is shorter than the other one. That's because your hip is not aligned. So let's work on that. We did that. And after a couple of weeks, my teeth did not align anymore. And that was one of the things that I've learned, that there is a direct connection. And the funny part is that, okay, then I got a splint to align my teeth, so my posture is straight, and the difference of my teeth are aligned. And at that point, I had no problems with my left knee anymore. So it was gone. When I was running 10 miles, whatever, no problem. If I forget the splint, I can run half a mile, and my pain starts get back into my knee. So that's pretty common. but nobody talks about it. So if I never had a patient coming from an orthopedic practice with a problem of a knee hurting, so that I can align it with a splint. Other parts where here comes the nutrition part in. When you see all these patients with these kind of problems, then you dig a little bit deeper when they clinch and grind and all have all these problems with their teeth. Then you find out most of them, almost everybody, has got inflammation. Almost everybody. If you dig a little bit deeper, then they have all these gut problems. They have thyroiditis problems, so Hashimoto's. They have other autoimmune problems. They have skin problems. They have brain problems like not dementia, but Parkinson's do have these same problems, but depression, anxiety, all that, they all combined. Usually nobody tells a dentist about that, but if you ask them and you tell them that the connection between them, then they get really astounded about the connection and why the problem in the brain do connect to these kind of things. And that's why I started to get, although I'm not allowed to treat them, but to ask more questions and try to solve all or inform them how they can find more informations. What's so funny is it's not only that when you have a problem with your adjustment of your teeth, because you have a problem with your leg or your hip is not adjusted, the other way around does also work. So if you get a crown or a filling or whatever, you do really change the posture of the person. So you can get all kinds of different problems, not only like grinding and clinching and headaches because of the muscle that I get problems, but you can also have problems with your ears. You can have balance problems because your inner ears is disrupted because of nerve problems. You can have like a tennis elbow. You can have digestive problems because if the skull changes because of pressure or the tension of the muscles, then the nerves that go out of the bottom of the brain, they get distracted because of the tension during the dura. And so you can get problems with your stomach. And even when you had one patient who got heart arrhythmias, and we solved that with a splint. So weird as it sounds, but and you can also have eye problems because there's a connection between the muscle and the muscle of the eye. So you can get my eye problems, but that's if you ask the patient, say, yeah, I have eye problems, and my ophthalmologist said he couldn't find anything. Said, yeah, but you're clinching like hell. There's no wonder that your eye does hurt, and you get problems with walking because your inner ear is disrupted because of the pressure of the joint here. But in 25 years, I never had any patient who was sent over to us with these kind of problems from any kind of specialist. So it's absolutely not into it in medicine. So nobody got the connection because we're only stupid dentists and who rely a little bit on the cheese and do fillings and all that, but it got nothing to do with medicine. Although I think we see more sick people and would be able to treat the sick people if we do find a doctor or a specialist we work together. And I just found one. And we just talked yesterday, and with my first patient, he sent him over to me because he thought there was a dental problem. I said, well, it's part of it, but the main part is yours. So she needs definitely some treatment, some help, nutritional wise, and some dental treatment. But the main part is really, I think, in my personal reading of her, was more like a psychological and nutritional part.
So what about in your experience over the time where you've been keto and then into carnivore? You must have noticed like the improvement in your teeth, like the reduction in need, like you didn't have the feeling as much that you needed to brush and that kind of thing.
Absolutely. Yeah, especially when you got carnivore, um, there really is no plaque on the teeth. It's really feel a little bit weird because years ago I had to do it 3 times a day because I think, well, my teeth are not clean. And now I say, well, I'm a dentist, I have to do it, but it really is strange. And when you go into this functional medicine thing, then you say, well, the fluoride maybe not that good because it inhibits the iodine for the thyroid. So, well, maybe you should not tell the patients to take fluoride anymore. But it's a little bit difficult because not everybody sees it that way. So I try to stay neutral on that. But if you listen to what's her name? Let me have a look at my name list here. Um, Elizabeth Bright, and she's really into iodine. And my wife found her because she was really interested in that. So if you listen to her, she said, "Oh, no tea, no fluorides, and all these halogens because they do interrupt with the iodine intake, or the uptake." So that was interesting to find out. And yeah, some other things where I try to get all this functional medicine into dentistry is I try I tried here a little bit to summarize it because there's a lot of things, depletion of vitamins like B1 or D2, D3, and all that, but that would take another day to get all this stuff into. But I thought it was quite interesting to get some informations out, and maybe the patients can find a doctor who's able to get the numbers and all that, so they can find a connection between their blood work and the problems that they have, and even especially with these TMJ problems with clinching and grinding and all that, because we do also do orthodontic treatment. Well, my colleague does that. And then she sometimes comes in and say, well, I want to treat them with braces and all that. What do you think about it? Because we need an implant, or how do we treat them? I said, have you ever looked at the muscles? You try to move your teeth or the teeth of the patient with grams or milligram power, and they are crushing here with 10 kilos. You really think you can work against 10 kilo with 10 grams? So it really is a problem if you have these kind of patients, and you have to try to work around these muscle problems to be able to treat these kind of problems with orthodontic things or periodontal problems, because it's really correlated. And if you have an implant and you grind like hell, then the teeth start to get into the bone because of the pressure, but the implant is not. Then you get all the pressure on the implant, and then you get periimplantitis because the pressure on the implant gets too strong. So you have to realign at these patients the crown on the implant, so that the pressure is not getting too strong, because otherwise you get these problems around the implant. But as I enjoy these metabolic stuff, I just want some information out. Maybe I find some other doctor who would like to talk about this, because it's only observational things. I don't have a study, and I just see patients, and I found this on the internet, and I see the connections because there's nothing out there about these connections. So have you heard about Gary Bracker? And he treated Dana White, is the boss of the UFC. Um, so when I heard that, and he said all these blood works things, and Dana White was on blood medications, and he's got enough money, so can afford good doctors, but nobody was able to help him, or made it even worse. And he made it because he's more profit from the functional or the biochemical part. Because he's a biological chemist or something like this. He's not a doctor, and he helped him. When you see all these connections, then you really start to think about how does some things work. If you do not eat meat, you've got problems with your B12. And if you have problems with your methylfolate because you cannot change folate into methylfolate, then you cannot use methionine, which is an amino acid, which the only one that contains sulfur. And if you don't have that, then you can produce homocysteine. And if you have homocysteine problems, then you cannot make glutathione. And glutathione is the most potent antioxidant in the body. But if you can't do that, then you cannot get rid of inflammation. And so it's really important to understand how these compounds get into the body and do solve problems by itself, because the body can produce a lot of glutathione if necessary, if you get the right amount of nutrition in there. But if you have problems, then you probably reduce your B6, because homocysteine's way to glutathione needs B6, and B6 is also needed in the production of serotonin and dopamine. And if you have an inflammation, according to Dr. Paul Mason, then you cannot use your free iron in the blood. And you also need iron to produce serotonin and dopamine. And later on with the serotonin, you need it for melatonin. And it's clear that if you have problems with producing serotonin and dopamine, and if you listen to George A. Eat or what's the other one? I'm not good in name. Yeah, Chris Palmer, right? Yeah, the brain energy guy. It's the same thing. It's always the connection is pretty easy. It's just energy flow. It's mitochondria production of energy. And if there is a problem in it, and when you listen to Thomas Seyfried, it's not the energy. Also, it's also the cancer. Where my parents come in, my grandparents, and my oldest friend who died of lung cancer when he was 55, 2 years ago. And I tried to tell him about it, but he won't listen. He was so happy that the medication worked, and he prolonged his life for 5 years. But I wasn't able to help him with the nutrition part, because the doctors always say, no, nutrition has got nothing to do with it. Enjoy your life and eat whatever you like. And it was very sad, but that's the way it is. And to get all these connections together, and you find all these psychological problems, which I find most of the people have when they come in my practice, because they have inflammation. Most of them have anxiety or depression or whatever. They don't tell me about it, but if I ask them, well, yeah, tiny little bit. And if you dig deeper, it sometimes gets really difficult, because say, okay, this information is not for me, it's for somebody else who can help you with that, because I would love to take more time, but I'm not allowed to. You can listen to you, but I can't help you. But that really is interesting, how many people with dental problems have problems with inflammation, autoimmune problems, and all these psychological things. Like I had with my foot, the oxalate and lectins. If you get these gut problems because you get problems with your leaky gut. What's leaky gut? It causes inflammation. So you get the same problem. You get inflammation. You get all these depletion of nutrients, and then you get problems with your serotonin dopamine level, and then you get neurological problems, and that usually is part of this clinching and grinding. And I just heard yesterday, I found somebody who said, I think it was Dr. Berg, I said, with the SSRIs to treat depression causes grinding and clinching with the teeth. Well, it can cause that. So it's also involved in this situation. And he said it's a connection to the serotonin that might has a connection with the muscle here. Why it is, I don't know. The horse of my wife does it too sometimes. So it's not only for humans; other animals do it too. And that's when my wife get problems with their menopause. Then she got into this estrogen and hormone replacement therapy. Then I dug also into that, and I found this wonderful colleague in Australia who's a functional doctor or functional medicine. She's not a doctor, but I don't care. She's good. She tells about this histamine, estrogen, and oxalate thing, and how that is connected all together. And then you find out that the homocysteine works in that way, and then you get all the sub things that occur. And if you can break that line, then you can produce like taurine or whatever. So you have got a problem with your bowel and with your bladder, gallbladder, and then you can get rid of the estrogen, because you can detoxify it correctly. And when you see that, a lot of patients, it's not very common to talk about it, but a lot of our patients with really severe clinching problems, which can't be solved with a splint, are women in their age between 45 and 60. So 80% in our practice. And my colleague,
Interesting.
and most of the patients are untreatable for a dentist, because there's nothing we can do to solve their hormone problems. And when I talk to my wife, she always says, yeah, it does make a lot of difference whether she takes the HRT or not. Even if the amount of estrogen she takes changes a little bit, it makes a difference. So it really is interesting how the connections are there, and so many others of these nutrients, depletions, and all that. And if you get into these biochemical pathways and you find out, okay, if you miss this here at this area, it can work. It's not working. How should it work? If you take away your like B6 in this pathway, it can't be used somewhere else because there's not enough B6 left, especially when you're inflamed 24/7.
If you're seeing a patient and you recognize that this could be something to do with inflammation or nutrient deficiency or something, what are you referring them to a doctor, or are you just saying maybe go home and watch these videos, or what are you doing?
That's the main problem. There is no doctor. I was so happy that I found one, a carnivore doctor right around here, because he moved from South Germany to Hamburg here. So I just try to get an appointment with him and talk to him, and to find a way to connect these two professions, and try to solve problems which are not treatable for one profession. You can't treat estrogen problem as a dentist. And one funny thing was, a couple of years ago, I was talking to a woman who studied agriculture and had a farm. We talked quite a lot, always when she's there. And then I said, well, if you get all these soy problems, you can't get pregnant. If you clinch with your teeth here, that was found in Germany 20 years ago. You activate your adrenals. There is a direct correlation, a connection between the brain stem, which controls the muscle here, and the adrenals. So if you clinch or grind, your adrenaline and your cortisol goes up. And then you've got blood pressure problems, you've got sugar problems because your blood sugar goes up. And that's one of the things that I wanted to miss that. There's also one part of the serotonin and dopamine problem, because if you interrupt adrenaline, and if you get adrenaline in the blood, and it correlates with the neurotransmitters in the brain, you're in fight and flight, and try to get pregnant at that time. It's almost impossible. And so if you have these problems, and then you take soy, which is a phytoestrogen, and this connects to the estrogen receptors. The lady told me, if we raise pigs and we want to grow, want to get that they're fertile, we don't give them soy. It doesn't work. But nobody talks about it. So it's funny. We're sitting here with a dental cleaning. I'm a dentist. You're working with pigs, and so the light goes up. And we're talking about gynecologist problems, and the gynecologist has no idea about it. That's funny. So it's really interesting to talk to people who are probably not in the medical field, but if you raise pigs or cows or whatever, you still do have to talk about health of a mammal. And
It's so interesting that the information is out there, but people don't kind of put it together, because everyone's off doing their own thing,
yeah,
like the thing with the pigs, and like
yeah,
people don't think, oh, maybe if humans do the same thing, we're going to have the same
absolutely.
problems.
Yeah, and one thing was also when you mentioned that, I have a cover of a magazine from horse riding because my wife is riding horses for centuries, and there was an article about a horse that was clinching and the disability of walking right. So you have to get rid of the clinching for the horse so that the rider can ride his horse correctly. And that was funny. And I have some patients who have horses, and I say, well, if you're sitting on a horse and your body is not aligned because you have back problems or hip problems, you should let me adjust your hips by aligning your teeth, because otherwise the horse doesn't understand what you want to talk to him. Because usually you talk via the hips by changing your weight on the horse, and not with the what do you call it in English? I don't know. It's like
The
the
reins.
yeah. So usually, if you're a good rider, you don't do it. You just do it by changing your weight a little bit. But if you're not aligned, you can only ride left way around good, and the other way it doesn't work. And they always say,
Ah,
why doesn't it work? Because you're not aligned. Your hip is high on the right side, and you can shift your weight to the right because your hip is off balance, and the horse doesn't understand you. But if the horse clinches, you have the same problems that the horse gets, and he gets a problem with running, and you have to solve that. So it's really interesting if you talk to that. And I have a patient of mine who works with horses with these hoofs, what do you call it in English?
yeah,
Um,
hooves. Yeah.
yeah, okay. And if you get inflammation there, he said, yeah, of course they get this inflammation if you get them too much carbohydrates, because horses do not need carbohydrates. And if you give them an apple or sugar or whatever, then they get these problems in their hooves. I said, does anybody know? Nope. Nobody cares. Everybody gives them an apple or whatever, and it's not the sufficient diet for a horse. Like it's not a sufficient diet to give grains or
Right.
maize to cow.
So yeah. It's so interesting kind of joining up all the dots, and you
It
realize
is.
that, yeah, everything is connected, and yeah.
Yep. And
Uh,
we're mammals. So all the
mm,
mammals will get the same problems that we have if they are stupid enough, or the owners of the mammals are stupid enough to give them all this crappy food. And if we, like ourselves, stop getting this crappy food in our bodies, then we get rid of all the problems, most of them. But
right. Yeah. It's kind of the foundation anyway, right? It's the basis of everything else. Get that
yeah,
right, then everything else becomes a lot
yeah,
easier.
that's what I try to tell my patients. You have to get healthy before I can treat you.
Mm,
Or you can lose weight. You have to get healthy before you lose weight. But I can't. If you have a inflammation in the mouth, and you have an inflammation in the gut and everywhere else, and that's only one part, and you have to get rid of all the problems that can be solved by changing your diet, and then the rest that is probably not solvable by all these nutrients and all this other stuff. Then there is a doctor to help you with this certain problem. But you don't put a
mm.
band-aid on a bruise and wait for it to heal. It's stupid. As long as the patient always run at the same corner with the same foot and get a bruise every day again, the band-aid doesn't work. You have to take stuff away where you're running against. So
Right. So, Volker, if people want to reach out to you, how can they get in contact? Do you have a website or any social media?
I just started that. My daughter did that for me, and we're on the Carnivore Dentist. The email is thecarnivoredentist.de for Germany. And we try to start that to get the information out, and you are the one who kicked my ass to do it. So I'm really thankful for that, because I thought about it for years and I had never the reason to do it, because in Germany there's nobody to talk to, and you're the first one really to talk to, where I talk to about carnivore and all that. And I think it's necessary, because when you see all the patients that you interview, all the doctors, they all say the same thing, and it's really, really important to get this information out. And even if it takes another 10 years in Germany for this information to be popular, well, I go for it. I tell everybody.
Yeah, absolutely. So I'll link to your email and site in the show notes.
Thank you.
Thank you so much for coming on and sharing your story and your experience. I really appreciate your time.
Thank you for having me.